Did you know your feet could be sending urgent warning signals about your heart? Most of us associate heart disease symptoms with chest pain or shortness of breath, but subtle signs in your feet, yes, your feet can reveal heart problems long before they become serious. Welcome to Health Horizon. I'm Dr. Thomas, and today we're uncovering 6 surprising foot signs of heart problems that you might be overlooking. These heart health tips could help you catch issues early and protect your life. Hit that like button, subscribe, and ring the bell to join our community for more life-saving health advice. Let's dive into how your feet can tell you if your heart needs attention. Why feet reflect heart health. Your heart is the powerhouse that pumps blood throughout your body, delivering oxygen and nutrients to every cell. Your feet, being the farthest point from your heart, are often the first to show signs when something's wrong. If your heart isn't pumping efficiently or your arteries are narrowed, blood flow to your feet can be compromised, leading to telltale symptoms. A 2021 study in Circulation found that poor circulation in the lower extremities is linked to a 30% higher risk of heart disease. Conditions like peripheral artery disease, PAD, or heart failure often manifest in the feet before more obvious symptoms like chest pain appear, while these foot signs of heart problems can sometimes stem from other issues like diabetes or kidney disease. They are critical red flags for heart health. Let's explore the 6 signs you need to watch for, why they happen, and what to do about them. 6 foot signs of heart problems. Here are the 6 surprising signs your feet may reveal about your heart health, along with practical steps to address them. 1. Cold feet or toes. Do your feet or toes feel unusually cold, even in warm weather or when you're bundled up? This could signal poor blood circulation, a common heart disease symptom. When your heart struggles to pump blood effectively or arteries are blocked, oxygen and nutrients don't reach your feet adequately. This is often linked to peripheral artery disease, PAD, where plaque builds up in arteries, narrowing them. A 2020 study in the Journal of the American Heart Association found that 20% of people with cold feet had undiagnosed PAD. Other causes, like Raynaud's disease or hypothyroidism, can also make feet cold, but heart issues must be ruled out. What to do? Keep your feet warm with socks or slippers, and avoid tight shoes that restrict blood flow. Elevate your feet when sitting to reduce pressure on veins. If coldness persists, see a doctor for a blood flow test, like an ankle brachial indexometry, to check for PAD. 2. Swelling in feet and ankles. Swelling in your feet or ankles, also called oedema, is a classic sign of heart failure. When your heart can't pump blood efficiently, it pools in your lower extremities, increasing pressure in veins and pushing fluid into surrounding tissues. You might notice your shoes feel tight or your socks leave. Indentations, especially after long periods of standing or sitting. A 2019 study in Heart showed that 60% of heart failure patients experience oedema. Swelling can also result from kidney or liver issues, but heart failure is a common culprit. What to do? Elevate your legs above heart level for 15-20 minutes daily to reduce swelling. Limit salt intake to less than 2,300 milligrams daily, as salt retains fluid. Compression socks can help, but consult a doctor to rule out heart failure with tests like an echocardiogram. 3. Skin color changes. If your toes, ankles, or feet appear bluish or purplish or have small dark spots, it's a warning sign of low oxygen in your blood. This condition, called cyanosis, occurs when your heart isn't delivering enough oxygen-rich blood to your extremities. A 2022 study in cardiology clinics linked cyanosis to a 25% higher risk of heart failure or PAD. Without enough oxygen, tissues can become damaged, leading to sores or ulcers. Other causes, like lung disease, may contribute, but heart issues are critical to investigate. What to do? Monitor your skin color regularly, especially in colder months. Keep your feet warm and avoid smoking, which constricts blood vessels. If you notice persistent discoloration, see a cardiologist for a CT angiogram to check blood vessel health. 4. Numbness or tingling. Persistent numbness, tingling, or a pins and needles sensation in your feet, especially during activity, is a red flag for peripheral artery disease. PAD occurs when cholesterol and fat clog arteries, reducing blood flow to your legs and feet. A 2023 study in vascular medicine found that 40% of PAD patients reported numbness before diagnosis. This sensation may worsen when walking or exercising and ease with rest. Other causes, like nerve damage from diabetes, can mimic this, but heart-related circulation issues are serious. What to do? Avoid prolonged inactivity. Take short walks to boost circulation. If numbness persists, request a Doppler ultrasound to assess blood flow. Quitting smoking and managing cholesterol through diet, for example, oats, nuts, can prevent worsening. 5. Wounds that don't heal. If cuts, blisters, or sores on your feet take weeks to heal or don't heal at all, it is a serious sign of poor circulation. Inadequate blood flow means tissues aren't getting enough oxygen and nutrients to repair themselves. This is especially dangerous for people with diabetes, as a 2021 diabetes care study noted that 15% of diabetic patients with non-healing foot wounds faced amputation risks due to pad or heart issues. Heart failure can also slow healing by reducing blood supply. What to do? Keep wounds clean and covered and avoid walking barefoot. Check your feet daily, especially if you have diabetes. See a doctor immediately for non-healing wounds. They may recommend a vascular study or angiogram to evaluate blood flow. 6. Pain when walking. Claudication, cramping, or pain in your calves, thighs, or buttocks while walking, which stops when you rest, is called claudication, a hallmark of peripheral artery disease. Narrowed arteries can't supply enough blood to muscles during activity, causing pain. A 2020 European Heart Journal study found that 50% of PAD patients experienced claudication as their first symptom. This pain may feel like muscle fatigue or a burning sensation and typically improves with rest. What to do? Start a supervised walking program, for example, 30 minutes, 3 to 4 times weekly to improve circulation. Avoid high-fat foods that raise cholesterol. If pain persists, consult a doctor for a stress test or OBI to diagnose PAD. Risk factors for heart issues. Understanding who's at risk for heart disease symptoms helps you act proactively. Here are the top risk factors linked to the foot signs of heart problems. Age over 60. Aging weakens heart function and blood vessels. A 2018 Journal of Cardiology study showed a 35% higher risk of PAD in seniors. Diabetes. High blood sugar damages blood vessels, increasing PAD and heart failure risk by 40%, per a 2022 diabetes research study. High blood pressure, uncontrolled hypertension strains arteries, raising heart disease risk by 30%. Hypertension, 2021. High cholesterol, excess cholesterol clogs arteries, contributing to 60% of PAD cases. American Heart Journal, 2020. Smoking narrows blood vessels, doubling PAD risk. Circulation, 2019. Obesity, excess weight increases heart strain and PAD risk by 25%. Obesity Reviews, 2021. Family history. A family history of heart disease raises your risk by 20%. Genetics in Medicine, 2020. If you have these risk factors, monitor your feet closely and get regular checkups. How to protect your heart. Preventing heart disease symptoms and protecting your heart involves lifestyle changes that also improve foot health. Here are practical heart health tips. Adopt a heart-healthy diet. Follow a Mediterranean diet rich in fruits, vegetables, whole grains, lean proteins, for example, fish, chicken, and healthy fats, for example, olive oil, nuts. A 2022 Lancet study found this diet reduced heart disease risk by 30%. Limit saturated fats, processed foods, and sodium to under 2300 mg daily. For example, swap red meat for salmon twice a week. Exercise regularly. Aim for 150 minutes of moderate exercise weekly, like brisk walking or swimming. A 2021 circulation study showed exercise improved blood flow in 70% of PAD patients. Start with 10-minute walks if you're new to exercise. Quit smoking. Smoking cessation can cut PAD risk by 50% within a year. Journal of Vascular Surgery, 2020. Join a cessation program or use nicotine patches. Manage chronic conditions. Keep blood sugar A1C7, blood pressure 13080 mmg/am, and cholesterol LDL 100 mg or DL in check with medication and lifestyle changes. Regular monitoring prevents complications. Stay hydrated. Drink 8-10 cups of water daily to support circulation, unless restricted by a doctor. Check your feet daily. Look for swelling, color changes, or wounds, especially if you have diabetes. Use a mirror to check hard to see areas. Wear proper footwear. Choose supportive shoes and avoid tight socks that restrict blood flow. Compression stockings can reduce swelling, but consult a doctor first. Tests to diagnose heart problems. If you notice any foot signs of heart problems, see a doctor immediately. Here are key tests to diagnose heart-related issues. Ankle brachial index (ABI) compares blood pressure in your ankles and arms to detect PAD, a score below. 0.9 indicates artery narrowing. Vascular Medicine, 2022. Doppler ultrasound uses sound waves to visualize blood flow in arteries, identifying blockages. It's non-invasive and highly accurate. CT angiogram provides detailed images of blood vessels to detect blockages or narrowing. A 2021 radiology study showed 95% accuracy for diagnosing PAD. Echocardiogram uses ultrasound to assess heart function, detecting heart failure or weak pumping. Blood tests check cholesterol, blood sugar, and markers like BNIP4. Heart failure stress test monitors heart activity during exercise to detect reduced blood flow. If you have risk factors or symptoms, ask for these tests annually. Early detection can prevent severe outcomes like heart attack or amputation. Key takeaway: act early for heart health. Your feet are a window into your heart's health. Cold feet, swelling, skin color changes, numbness, non-healing wounds, and claudication are critical heart disease symptoms that demand attention. While these foot signs of heart problems can have other causes, they're often linked to heart failure or peripheral artery disease. Catching them early with regular checkups and tests like a CT angiogram can save your life. Combine these heart health tips: healthy diet, exercise, smoking cessation, and daily foot checks with prompt medical care to protect your heart and feet. For more advice like heart healthy recipes or exercise tips, check out our related videos in the description. Always consult a doctor for persistent symptoms to rule out serious conditions. That's your guide to 6 sure signs of heart problems you can't ignore. Start checking your feet today to protect your heart and stay healthy. If this video helped, give it a thumbs up, share it with friends, and subscribe to Health Horizon. Ring the bell for more life-saving health tips. Comment below which sign surprised you or where are you watching from. Explore our heart healthy diet video or our cardiovascular health playlist in the description. Thanks for watching, and here's to a stronger, healthier heart. See you next time.